Hello, welcome. How can I help you today? Okay. Okay. You've been feeling very chesty. The bad cough. And how long have you had this cough for? Okay, so it's been a while. Can you describe the cough for me? Yeah. And what sort of home remedies have you been trying at home to help get rid of the cough? Okay. And nothing seems to be helping. Okay, so the phlegm that you're bringing up, can you tell me the colour of it? Okay, so it is green. Okay, have you checked your temperature at all? Do you know if you've got a fever? No, you've definitely done the right thing. There is a lot of bad colds and coughs going around at the minute, so some people it's going away on its own, and others it's not, and they need a little bit of help. So what I'm going to do is first of all check your temperature, okay? So can you just stick out your tongue, lift it up for me. Okay, and we're just going to let that sit until it's ready, okay? Okay, so you're running just a little bit of a temperature. I'm just going to jot that down. It would make sense if you do have a chest infection that you would be running a little bit of a high fever. Okay. Next, I would just like to check your oxygen levels and your pulse. Okay, so if you can just stick your finger in here for me, and then try and keep perfectly still, and we'll just wait until that's ready as well, okay? Just gonna let that sit for just another couple of seconds, okay? There we go. Sometimes it can take a little while just to kick in, so I'm just going to take that off now. Perfect, okay. That seems to be fine, nothing to worry about there. Oxygen is probably just a tad low, but I am not too concerned about it. If you've got a chest infection, your lungs, do you know what I mean? It's going to taking a little bit less oxygen, but I'm just going to check your chest now, okay? No, you don't need to take it off, it's fine. I'll just go down or up, easier. Okay, I'll go up, that's fine. So just keep him perfectly still for me. Okay, just breathe normal for me. Just going to move it around a little bit, okay? Can you take in a deep breath in for me? Out. Excellent. Deep breath in again. And out. Another deep breath in for me. And out. Okay, I'm just going to go around the back and have a listen. You do another deep breath in for me. And out. A deep breath in. And out. Okay. Okay, I'm just going to listen on the other side now, okay? So I'm just going to lift your top again. Just normal breathing for me for now. That's okay. If you need to cough, you can cough, it's fine. Don't try and hold it in. I'm going to ask you to take a deep breath in for me if you can, as deep as you can go. And out. Get another deep breath in for me. And out. Okay, and I'm just going to slide around the back ever so slightly. Okay, so you definitely have a chest infection. Your lungs are quite crackly and popping. Your right lung is worse than the left one. If you can, try and break the phlegm up when you cough. Please do, because it's going to help get rid of the infection quicker. I know it can be really difficult, but if you can, try and get it up, then get it up. So I'm going to prescribe you an antibiotic, okay? It's going to be a 5-day course, and I want you to take 3 tablets a day. Okay, so try and space them out, so in the morning, in the middle of the day, and at night for 5 days, okay? If they don't work, obviously come back and see me, okay? Do you want me to print this prescription off for you, or do you want me to send it straight to the chemist? Okay, I'll send it straight to the chemist, yeah. The sooner you can go and pick them up, the better. It's getting a little bit later in the day now, so I would suggest starting them tomorrow. Okay, tomorrow morning. Okay, that has been sent. You are free to go, but come back after about a week if there is no change. Okay. Excellent, no problem. Enjoy the rest of your day. Okay, so we are back. Did the antibiotics not work? What's going on? Okay. Okay, so it sounds like they've helped a little bit. You're still bringing up phlegm, but it's not green. It's clear, but you're still bringing it up. Okay. Okay, so the cough has subsided a little bit, but since you stopped taking the antibiotics, it's been getting worse. Okay. Yeah, okay. So we generally prescribe the antibiotics for 5 days, but oftentimes you do need a little bit extra, so throat a little bit because you can't really get it up. Okay, so let's go ahead and do what we did before. I'm going to check your temperature again just to see if you're still running a fever. So open wide. I'm just going to pop this under your tongue, and then we're just going to leave that until it's ready. Okay. Okay, excellent. No fever this time. That's perfect. I'm going to go ahead and check your oxygen again and your beats per minute. So, finger. Excellent. And then we're just going to let that sit for a couple of seconds till it's ready, okay? Okay, excellent. That's perfect, excellent. Oxygen levels have gone back up, so that's a really good sign. Been getting enough fluids? Yeah. Have you still been trying any home remedies, over the counter, medicine? Okay, what have you been trying that's different from last time? I know it's a silly question, but you have been getting enough rest, staying in bed, trying to, you know, rest your body as much as possible. Okay, let's go ahead and have another listen and see what's going on. There we go. It's cold today, I haven't used it yet, so. Okay, you ready? Okay, yeah, I'll go down your top this time since it's a bit easier. There we go. So just breathing normal for me. Again, I'm just going to move it around slightly. Can you take a deep breath in for me? And out. Excellent. Deep breath in and out. Fantastic. I'm just going to move around the back. Deep breath in for me and out. Deep breath in and out. Fantastic. And then I'm just going to listen to the other side now. Okay, so can you take a deep breath in for me? Excellent. And out. Deep breath in and out. Another deep breath in for me and out. Okay, I'm just going to quickly go around the back. Go take a deep breath in for me and out. Excellent, okay. Okay, so it does sound like the crackling is still there a little bit in the right lung. The left lung does sound clear, so that's good. So it is clearing up, it just needs an extra nudge. So what I'm going to do is I'm going to give you the same antibiotics again for the same course, okay? So 3 tablets a day for 5 days, okay? Again, spacing them out as you were doing before. Make sure to finish the course, even if you do feel better after a couple of days, finish the course, okay? Do you want me to send the prescription to the chemist again? Okay, there we go, that is sent to the chemist. So you're done, okay? I think this course will work and get rid of it fully. If there are any problems or any concerns, come back and see me again after about a week, okay? Excellent. No problem at all, that's my job. Enjoy the rest of your evening and I'll see you again soon. Good evening, welcome to this cranial nerve exam. I am actually new here, so you're my first person I am doing a cranial nerve exam on. So please bear with me, I may be a little bit slow, I'm not sure. I do have some notes here that I will be following and looking through just to make sure that I do everything right, okay? So, have you had a cranial nerve exam before? Okay, you have, so you probably will be a bit better at it than I am, knowing what to do and what's going to come next. So I won't explain too much then, but we are just going to check all your nerves, your sense of smell, sense of taste, the sensation in your face, your eyes, and so on. Okay, so, and if I find anything that is concerning, I will then pass that on to the specialist, but I doubt very much that we will find anything. This is just a routine checkup, it should go quite easy. That's why I have been giving it you this evening. So my hands are clean. Is it okay to just position you a little bit? So I just want you standing. You can sit down if you want, or are you comfortable standing? Okay, so I'm just gonna, that's perfect. I want you to be able to see the chart a little bit later on. And now I'm just gonna have a little look at your face. I do have your notes also here from last time, so I can compare any differences. Okay, so just standing still for me, just checking the symmetry in your face. I'm just looking for any droopiness or anything that doesn't quite look right. Okay, everything is looking fine on your face. Excellent. Can you make some facial expression for me? Let me just pop that down. Can you do a big smile with your teeth for me? Excellent. Can you puff out to your cheeks? Excellent. Can you suck them in? Fantastic. Can you raise your eyebrows for me? Perfect. And can you frown your eyebrows? That's perfect. Excellent. So let me just do a quick jot down. I'm not going to write a lot down, otherwise we're going to be here for a long time. But I'm just going to write on the notes that were taken last time. if there is any change or not, and all of that is exactly the same. So let's move on to the sense of smell, which we call the olfactory nerve. Okay, I have some little pipette bottles here. I'm just going to ask you to smell the different smells, okay? So all of the bottles are exactly the same, so there's no cheating. Excellent, that is correct. Okay, let's go for this one. Just have a nice big smell for me. Perfect. Let's have a little look. They were quite easy, so let's pick something a bit more challenging. Okay, have a smell of that one. Yeah, so that one is a bit more difficult to pinpoint. Have a go. It is a well done, correct. Okay, let's go for this one. And have a smell of that. Yeah, it's quite a faint smell, that one. It's not very strong. Excellent, fantastic. Okay, let's just do one more for the sake of it. I'm going to pick a tricky one. Okay, let's pick this one. This is probably the one that most people get wrong the most often anyway. Yep, sure, I'll let you smell it again. That's quite a faint smell as well. Okay. Yes, that is what it is. Well done. A lot of people do get that one wrong quite often. Okay, let me just say that was a full house, exactly the same as last time. That's perfect. Sense of smell is working excellent. Okay, so we are going to move on to your eyes, okay? And we do have to do quite a lot with the eyes. So the first thing I'm going to ask you to do is look at the Snellen chart. Okay, I'm going to move it here. Oops, the light. There we go. So we don't need to worry about the E at the top. That's pretty easy. Let's start off at line 4 for me. Perfect. And line 5 if you can. Excellent. Okay, line 6, please. Excellent. Okay, line 7. Fantastic. Okay, can we do line 8? That is perfect. That's where I want your eyes to be. Let's just go ahead and see if you can do line 9. Well done. Let's just do line 10 and the last line 11. Excellent. Fantastic, another full house. Well done. Okay, so next we're going to check your visual field. So you know how this works. I just want you to look at my chin. Do not move your head or eyes, just look straight at my chin. And I would like you to tell me when you can no longer see my fingers, okay, when they go out of your field of vision, okay? So perfect. Excellent. Good. Fantastic. Just quickly. That is perfectly fine as well from the last time. I don't know if you will agree, but I feel like it's feeling quite autumnal outside. It's making me feel very cozy, and it's making me feel very excited for the autumn and the winter. Do you agree? Ah, excellent, good. It's my favourite time of the year, the end of the year, so it's feeling very cozy and autumnal outside today. Okay, so I'm going to have a little look at the back of your eye now, okay, using this. So it's not very bright, it should be okay. Just let me know if there is any discomfort, okay? And if you hear my stomach growling, I apologise. I skipped dinner, which was naughty of me. So you can just look straight ahead for now. That would be excellent. Okay. So if I just pop your lid up, can you look up for me? Excellent. Can you look down for me? Fantastic. Can you look to the left? And to the right for me? Excellent. Take a look at the other eye. So again, standing, looking straight ahead, sorry. Okay. Oh dear. Okay. Just gonna pull your lid up. Just going to, can you look up for me? Okay, excellent. Can you look down? Can you look to the left for me? And to the right? Okay, excellent. The back of your eye looks perfectly healthy. Let me just double check what is on the list. Okay, so going to have a look at your pupil response. Okay, so just look straight ahead for me. Just going to shine the light in and out. Okay, just looking at how your pupils react. Fantastic. I'm going to do the same again, but I'm just going to use a brighter light this time, okay? Okay, that's fine. Just going to grab the other light again. What I'd like you to do, okay, is just follow my instructions. So I'm going to have the light up here, and I'm going to either ask you to look at the light, my chin, or the letter E, or the plant. Okay, so that's quite a few things. So the plant, the letter E, my chin, or the light. I'm going to move the light down here. And yes, I'd like you to just look at what I say. Okay, so look at my chin to start with. Look at my chin, and look at the plant, and look at the light. Look at the letter E. Look at the plant. Look at my light. Look at my chin. Keep looking at my chin. Look at the letter E. And look at the light. Excellent. Fantastic. Okay, let me just have a quick just double checking a few things. Continuing with the eyes just now, there's a few different areas of the eyes that we can test different things. It might not seem like we are actually testing for different things, but we are. If you could just look at my chin, okay, and I would like you to tell me which fingers move, okay, the left or the right, okay, so your left or right, okay. Excellent. I'm just going to move them a little bit. Excellent. And again, just moving them. Okay, fantastic. Last little thing that I want to do with the eyes, so I just want you to have a little look at these for me and tell me what you can see. So it might be a shape, an object, a letter, a number, it could be anything. So just let me know what you can see. Excellent. Fantastic. Yep. Great. Well done. Good. Yep. Correct. Fantastic. Nearly done. Correct. Well done. That was another full house. Okay, I'm going to quickly test your sound. Okay, all I want you to do, it is very, very simple. This test is close your eyes for me, and I'm going to make some clicking sounds in each of your ears, kind of like a keyboard clicking, and I just want you to tell me which side you can hear it, so your left or your right, and how many clicks. clicks. So just say left 4 or right 1. Do you know what I mean? So close your eyes for me. Okay, and we're going to begin now. Excellent. Fantastic. Good. Okay, I'm going to hold it a little bit further away, so just let me know if you can still hear it and how many clicks on what side. Okay, excellent. You can open your eyes. The object I was using was this little key ring that has little keyboard bits on it, so it's quite easy and fun to use in this exam. Okay, so a couple of things I want to just check on your face, and that is sensitivity. So basically, I would like you to close your eyes. I have two things here. I have a spoolie, which is soft. You wouldn't think so, but it is. And then I have a really soft brush. And I just want you to tell me if you can feel the spoolie or the brush. Okay? So excellent. Good. Good. Okay. Okay, good. Okay, excellent. I'm happy with that. You can open your eyes. Okay, the last little thing I want to do is test your taste. So I have some little drops here, and I'm just going to pop them on your tongue, and I'd just like you to tell me the taste. So they are flavoured, but they are either a salty taste, a sweet taste, a bitter taste, or a sour taste. Okay. But they are flavoured. I'm not just going to put some lemon on your tongue or some salt. Okay, so they are flavoured. There is a little glass of water there just at the side of you. So if in between tasting these flavours you want to cleanse your palate, then there is a little glass of water there ready. But if you are ready, let's pop out your tongue. Again, these are all in the same containers. Yes, that was the sweet one. Okay. Yeah, have a little drink, that's fine. Okay. Yeah, bitter. Yeah, you can kind of tell that straight away, can't you? Okay, so we have 2 left. Okay. That one is sour. And then I want you to just tell me if you can taste the last flavour, even though you can probably guess what it's going to be. Excellent. Yes, it was salty. Okay, so your cranial nerve exam today is excellent. I don't see anything different at all from the last time you came in. Everything is working exactly how it should be, so that is perfect. I am just going to write everything up a little bit better and send that to who you usually would see. But thank you so much for letting me do your cranial nerve exam today, and hopefully I will see you again very soon. Okay, so I can see that you've had a little bit of a nasty fall. So I'm going to just take a little look and clean you up a little bit, okay, with my first aid kit. I am a trained first aid, so you are in good hands with me, okay. Your injuries don't look too serious, so I don't think that we need to take a trip to the doctors or the hospital, so I think I should be able to clean you up just here. Okay, let's see what I'm gonna need. I'm just gonna have a little look first, okay? How much pain are you in, or discomfort? Okay. And is this the only injury that you have, just up here? Oh, okay, so now you've got on your palms. Okay. I'm just going to use this light to have a little look what it is in the wound, if that's okay. It does look quite sore. I think it looks worse than what it is. It looks a little bigger than what it actually is. I think when we clean this up, it will look a lot smaller and a lot better. It does look like there's quite a lot of dirt in there, maybe a little bit of gravel, some stones. I might need to pluck those out. Okay, just pop your palms up for me, that's good. Okay, so they don't look as bad. They still have some dirt and gravel in them, which we will sort out, okay? Okay, I'm going to just get a few bits out. This is a pretty jammed packed first aid kit, as you can see, so there is everything we are going to need in here, so do not worry about that. Definitely going to need those. We won't use those too. Okay, we'll have that. Come back to that later. Might come back to those later as well. Oh, we have a little ice pack in here, so if we need to use this, we can. who haven't seen one of these before. So basically there's just little tiny beads in here, and what you do is you squeeze and break up the beads, and then they turn cold and you can use them, you know, as and where you need to. They're good, aren't they? You can get heat ones of these as well. It's the same sort of concept. You squeeze and break the bead inside, and then it turns warm. I don't think we're going to be needing this. There is some liquid in here as well, but I don't think we're going to need these today. Have a quick look what is in this side. So we've got some bandages up there, and then we've got some plasters, some other bandages. Okay. The first thing that I'm going to do before that is pop on some gloves, just because I don't want to transfer. My hands are clean, but I just don't want to transfer anything onto your wound and make it worse. So I am going to pop on just a couple of gloves just to be extra clean and safe. Okay, let me get another one. Okay, so first thing I'm going to do is I'm going to wipe the area down, just to see what we're working with and how much gravel and dirt is in there. I want to try and get as much of that away as I possibly can and clean it before trying to pick out anything that's there. Okay, this is an alcohol wipe, so it's probably going to be a little stingy. Okay, but I will be as gentle as I can. Okay, so if it gets too much, you can let me know. We can take a break. Okay, but are you ready? Okay. I do have to be a little I do have to put a little bit of pressure on just to make sure I'm really cleaning it, okay? But I am being as gentle as I can. I think it's just the initial shock when it first touches. It can be a little stingy. Okay, good. Okay, it's looking a lot better and a lot cleaner already, so that is great. Just going to use the light just to make sure that I can see everything clearly. Okay, a lot of that has come off while I've been wiping it, so there isn't too much to pull out, so that's great. Okay, we will go ahead and get another one, and I'm going to do your palms, okay? Okay, so just hold out your palms for me. Brilliant. Yeah, a little stingy, but you should get used to it. This one isn't too bad, so that will do for that one, and then the other one. Again, this isn't quite as bad. I think your face has got the brunt of the trauma. Okay. That's looking a lot better already. Can you see? It looked quite big at first, but because I've wiped away most of that was there, it's just a tiny, tiny scratch now. So, okay. Don't think there's anything to pull out of those. Let me just grab. No, there's no gravel or dirt in them now, so that's fine. Just going to make sure they have a thorough clean, okay? Okay, they look lovely and clean now. So what I'm going to do, you do have a few gravel bits on your head there, okay, so I am going to try and get them off, okay, as gently as I can. I'm going to use these because these are a lot pointier than my fingers, so just keep still for me. If anything hurts, let me know. Okay, there isn't much, there's just a couple of stones, like little tiny bits of gravel. Okay. Want to make sure we get them out because we don't want them to start infecting the area. Okay, you're doing really, really well. Excellent. They're just little tiny broken bits, you can't really see them. Okay. It's looking good, I think. Oh, I think there's just a little one just there. Okay, that's looking so much better. Taking out a few, well, all of the little gravel bits. Okay. Just okay, so I'm going to go ahead and just give the area another clean before we go ahead and put a bandage on that, because well, not a bandage, but a pad, because it's quite, it's not big enough that you need to go and get any stitches or see the doctor, but I just think you should protect that area, just for the day, maybe tomorrow. But I want to give it another clean, just because we've been using these which are sterilised, but I want to give it another proper wipe also. Okay, so just, this might sting again, this is a little bit stronger, so it might sting a bit more. Okay. Oh yeah, it's a bit stingy. Let me just blow that. Okay, can I go in again? Okay. Let's leave that to dry. And I'm just going to grab a pad to put on, okay? Let me see what we have. I think that's, what's this? Don't need that. That's, large. We don't need that, that's a bit too big. Okay, so oh, there's a little one there. Will we use that? Have we got any more of those? Just debating on what to use. Okay, I think we're going to use this, okay, which is just a big plaster. Okay, so I'm going to open this up. As you can see, it is just kind of a big giant plaster. So this is what we're going to just place over your wound up there. And I mean, it's up to you how long you leave it on, but I would leave it on for the rest of today, maybe tomorrow, just to keep it clean. Okay, and then you want to take it off and let the air get to it. So let's take this off. Standing perfectly still for me. I'm just going to stick that there. I'm just going to press that down gently. Okay, how does that feel? Feels okay. Yeah, I imagine that you might have a headache. Okay, let me just have a quick look at your palms. Yeah, they still look fine. They've cleaned up really well. They're just tiny, tiny scratches. Okay, so you are nice and cleaned up. You don't have any other wounds or scratches. So I think you're good to go. Okay, what I would probably suggest you do is go home, take a headache tablet, lie down in a dark room, put some nice meditation on, or some soft rain sounds, or whatever sounds you enjoy, and try and relax, okay? And your headache should go away, okay? Just take care of this wound. Okay, I'm glad that I could help you today, and I'm glad that I have managed to help you with that. So go and enjoy a nice relaxing evening, and I'll see you again very soon.